अस्सलाम वालेकुम एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। आज हम बात कर रहे हैं द lesions of the laryngeal nerve. The muscles of the larynx are innervated by recurrent laryngeal nerve, with the exception of cricothyroid, which is supplied by external laryngeal nerve. Both these nerves are vulnerable during operations on the thyroid gland because of the close relationship between them and the arteries of the gland. The left recurrent laryngeal nerve may be involved in the bronchial or esophageal carcinoma, in the secondary metastatic deposits in the mediastinal lymph nodes. The right and the left recurrent laryngeal nerves may be damaged by the malignant involvement of the deep cervical lymph nodes. The section of the external laryngeal nerve produces the weakness of the voice because the vocal cord cannot be tensed. The cricothyroid muscle is paralyzed. Unilateral complete section of the recurrent laryngeal nerve result in the vocal fold on the affected side. Assuming the position midway between abduction and adduction, it lies just lateral to the midline. Speech is not greatly affected because the other vocal fold compensate to some extent and move toward affected vocal folds. Bilateral complete section of the recurrent laryngeal nerve result in the both vocal folds assuming the position midway between abduction and adduction. Breathing is impaired because rhinoglottis is partially closed and speech is lost. The unilateral partial section of the recurrent laryngeal nerve result in a greater degree of the paralysis of abductor muscles than of the adductor muscles. The affected vocal fold assume the adducted midline position. This phenomena has not explained satisfactorily. It must be assumed that the abductor muscle receive a greater number of the nerves than adductor muscle. Thus, the partial damage of the recurrent laryngeal nerve result in the damage to relatively more nerve fibers to the abductor muscle. Another possibility is that the nerve fiber to the abductor muscles are traveling in a more exposed position in the recurrent laryngeal nerve and are therefore more prone to be damaged. Bilateral partial section of the recurrent laryngeal nerve result in the bilateral paralysis of the abductor muscle and the drawing together to the vocal folds. Acute breathlessness and stridor follow, and cricothyroidectomy and transectomy is necessary. The mucous membrane is loosely attached to the underlying structures. Then we are talking about in the region of the vocal folds, however, the mucous membrane is firmly attached to the vocal ligaments. This fact is of clinical importance in the cases of the edema of the larynx and the accumulation of the tissues fluid, causing the mucous membrane above the rhinoglottiditis to swell and encroach on the airway. In severe cases, a cricothyroidectomy may be necessary. The interior of the larynx can be inspected indirectly through a laryngeal mirror passed through the open mouth and into the pharynx. A more satisfactory method is the direct method. Using the laryngoscope, the neck is brought to a pillow and the head is fully extended at the atlanto-occipital joints, and the illuminated instrument can then be introduced into the larynx over the back of the tongue. Thank you so much guys for watching the video. Keep supporting.